Hey everybody, in this video we're going to compare the outcomes of bariatric surgery to those of GLP-1 analogs, these injections, weight loss injections, Ozempic, tirzepatide, essentially GLP-1 analogs. Bariatric surgery has been the gold standard for a long time for weight loss. In this video series, which I'm going to be doing, I'm going to compare bariatric surgery to these GLP-1 analogs, these injections, not just for weight loss, but for diabetes, blood pressure, heart failure, MACE or major adverse cardiac events, and mortality. So we're going to look at a lot of different questions and compare these two different therapies. In this video, we're going to compare specifically the weight loss outcomes between people who have bariatric surgery and people who use weight loss injections. This is an obvious question. To do this, I'm going to refer to a pretty good meta-analysis published fairly recently. This paper was published in 2022 in the Obesity Society periodical. The authors performed this meta-analysis looking specifically at any randomized controlled trials as well as observational trials, primary studies that compared bariatric surgery to GLP-1 analogs for weight loss. Ultimately, this meta-analysis included data from 6 studies and a total of 332 patients. The patients received either bariatric surgery or weight loss injections. The primary outcome was weight loss, and what they found is that bariatric surgery resulted in greater weight loss compared to these weight loss injections. The mean difference was around 26 kilograms. In those studies that were randomized controlled trials, the difference of means of weight loss between bariatric surgery and the injections was 22.68 kilograms, meaning that on average, over the time period studied, people who had bariatric surgery lost about 22.68 kilograms more than people who had weight loss injections. And part of that is weight regain in people who had injections and for whatever reason ended up not using them anymore. Now, in those same randomized controlled trials, the mean difference in BMI was over 8. So people who had bariatric surgery, their BMI was decreased 8 more units compared to people who had weight loss injections. Something that's very useful in these types of meta-analyses is what's called a forest plot. This allows you to sort of line up and organize these studies and compare the different weighted outcomes, and I'll include that here in this video. The forest plot is quite clear that in these studies, and I feel that this meta-analysis is very representative of the literature looking at this question. It's very clear that bariatric surgery results in more weight loss than these weight loss injections, which are largely GLP-1 analogs. This has been very consistent for a decade or so. Many people who prescribe these injections will claim, hey, this is like having bariatric surgery without the risk. But the truth is the outcomes are still significantly different. Bariatric surgery is unparalleled in the success in weight loss, as well as many other outcomes, diabetes, etc. But for this video, we're just looking at the weight loss. Now, some might ask, well, what about the newest one, tirzepatide? That will be an interesting question. There was recently, just 2 weeks ago, a talk given at the ASMBS, a big organization, obesity organization, bariatric surgery organization, and the authors presented data there showing that the same result, that bariatric surgery is significantly more successful as far as weight loss compared to these GLP-1 analogs, and I believe they included tirzepatide in their data. So one of the differences in these therapies in the medical literature is length of studies. Now, bariatric surgery, we've got 20 and 30-year data for bariatric surgery. With these weight loss injections, we really have in the big trials 1 and 2 year data, and all of those studies are quite clear that when people use these injections and then they stop using them for whatever reason, cost or side effects, the people largely gain most of their weight back fairly rapidly. And so this is something also that can be easily missed, that the data that we have for bariatric surgery, the 10-year data suggests a total weight loss average of 25 to 30%. That's in 10 years. And so it'll be interesting to see longer term studies with these GLP-1 analogs, again, Ozempic, tirzepatide, longer term data, which we don't currently have. But what we have so far shows, again, significant superiority of bariatric surgery compared to any other therapy for weight loss. Now, thrown in here really should be the question of cost. What is the cost of these different therapies? Bariatric surgery, it depends on where it's done, but at our surgery center, for example, a person can get a all-inclusive cost of between $14,000 and $15,000 for the bariatric surgery, which includes everything. Now, typically these Ozempic, tirzepatide, they run about $1,000 a month. So if you look at 10 years, which is really how we should be viewing these things when you look at the population and population health. 10 years, what does it cost with these injections over 10 years? Well, $1,000 a month is $12,000 a year on average. 10 years, that's $120,000. And again, we don't even have the data to suggest that these injections will continue to be successful. There is some degree of tolerance that develops, and that's in large part the reason pharma is working so diligently to come up with new cocktails of these medications. People become tolerant to them, and they lose their effectiveness over time. We know that. So again, in just looking at weight loss, bariatric surgery remains by far the best therapy to treat obesity, morbid obesity. It's really not in question at this point. So it's not only most effective, but it's far more economical. Over a year, 5 years, 10 years, there's really little comparison as far as the cost. Now, people will say, you're a bariatric surgeon, of course you're going to be biased in this. Well, yes, we all have bias, but these are the numbers, this is the data, and you really do not hear much about bariatric surgery in all these conversations about weight loss currently, and it's something that's missed. And I want to raise this important point that, look, the most effective treatment we have also is far more economical than all these injections that people are clamoring over. So if the interest is long-term success and doing so in an economical fashion, to date, being 2024, nothing approaches the appropriateness of bariatric surgery. In the next video, we'll look at the same comparison, bariatric surgery versus the GLP-1 analogs, these injections, as far as diabetes. Which is more effective in improving and reversing diabetes? Until next time, thanks for joining us. If you enjoyed the video, please hit the like button and subscribe to receive notifications of additional videos.